Karen, thank you so much for bringing us a state perspective on how organizing around the vital conditions framework can really be powerful. Um, as Becky mentioned, with the National Association of Community Health Centers, we represent the over 1,400 community health center organizations that operate now close to 16,000 clinical delivery sites across all 50 states and territories, serving over 30 million patients every year, the majority of whom live below federal poverty guidelines and are people of color, ethnic minorities. Um, Next slide, please. I think the important thing to recognize about community health centers is they are patient governed. So 51% of the health center boards need to be comprised of people that are actually consumers of services. So these are consumer driven organizations. And, when we looked at overlaying our social drivers of health work at NAC with the vital conditions, we saw some clear examples of health centers around the country that really doing exceptional work in this space. So I hope in just a few minutes to kind of highlight along the vital conditions framework some health centers that really have sort of stepped forward, recognizing gaps in their community that go beyond their primary medical, dental, behavioral health, pharmacy, and enabling services that they provide to really stepping into those aspects, those social drivers of health that are really impacting health disparities and impacting the patients they serve. And the first example I want to highlight is actually in Milwaukee, Wisconsin. It's 16th Street Community Health Center. They really have focused for over 20 years now on impacting the natural environment that surrounds that community health center, particularly in revitalizing a local river, watershed, and parks, but also incorporating environmental health into their work in educating communities, particularly school children. And most recently, they've taken this work and incorporated a behavioral health program that focuses on being a part of the natural environment and getting away from urban centers to be able to have some mental health healing. So 16th Street in Milwaukee, Wisconsin. Next slide, please. So, for an example of basic needs for health and safety, that's essentially what health centers do. But I wanted to highlight one health center in particular that has stepped forward to address the needs that exist in emergency situations to assure that their community health center patients and the surrounding area have access to care regardless of the situation. This is Crescent Care in New Orleans, Louisiana. They're in the Lower Ninth Ward. Their health center and community has been hit repeatedly with storms and natural disasters. And through generous funding from Direct Relief, they've actually installed solar microgrid systems that will allow them to not only be mitigating the climate crisis by generating their own clean power, but they will also be able to be up and operational when power is down after a storm or grid outage to be able to make sure that the community in their area has the care they need. They're also partnering with other agencies in their community to extend this work in what's known as a lighthouse initiative. So several agencies in that community will have these solar microgrids. They'll all be pre-positioned to provide resources to people during times of disaster or emergency. They will take the lived experience and input from their community to develop these plans. Obviously, Crescent Care will provide the health care, but there'll be other organizations providing food, shelter, clothing, and the like, based on experiences in the past. So extending beyond just basic needs for health and safety, I think, is an example of Crescent Care in New Orleans, Louisiana. Next slide, please. So looking at humane housing, this is an example that I am incredibly excited about. It's Tepeyac Community Health Center in Denver, Colorado. The Denver, Colorado area has a housing crisis. They have a homeless crisis. And when the health center had an opportunity to build out a new building, they really looked to see how they could extend their impact into this problem area. So this community health center launched a development program that actually built a community health center on the bottom level of this building that you see. It's a full service community health center, medical, dental, behavioral health, pharmacy, but they also have next to it a healthy food mart. So that the community health center patients can also be able to access healthy foods. And then the incredibly unique thing about this effort is they built on top of the community health center 150 units of affordable housing. This just opened up in May. I'm looking forward to getting a chance to see it when I visit Denver next month. Very exciting project addressing housing in a crisis area. Next slide, please. Meaningful work and wealth. A health center that's close to where I am in North Carolina is OIC Community Health Center in Rocky Mount, North Carolina. They are part of a network of entities called Opportunities Industrial Centers, based out of Washington, D.C., but extended across the country. This health center actually provides career pathways for individuals in their community, particularly focusing on individuals that have been previously incarcerated, looking at construction, trade, manufacturing, and other career launching experiences, certification programs, partnering with community colleges. They have a classroom sessions coupled with real world on the job opportunities for lifelong learning. So that aspect of meaningful work and wealth is an area that OIC Rocky Mount specializes in. So next area of vital conditions, next slide, please, is lifelong learning. So an example that comes to my mind is Stigler Health and Wellness in Stigler, Oklahoma. They actually had the opportunity to take on Head Start facilities. There was an organization that was transitioning out. They had the opportunity to assure that the communities that they served did not lose this vital resource for families. So they actually brought these Head Start centers into their organization and now operate 20 facilities in southeastern Oklahoma, 43 classrooms serving over 700 children. Wow. This is a great way to assure that children are getting the right start that they need to be successful in school. So lifelong learning, one example is Stigler Health and Wellness Center, Stigler, Oklahoma. Next slide, please. Okay, reliable transportation. This is a big issue in urban areas, but particularly in rural areas. And Valley-wide health systems in Alamosa, Colorado, saw the need, saw that there were other agencies that had a need for transportation services and decided that they would pick up the mantle and develop a system that actually has become sustainable. So this Valley-wide ride focuses on essentially a prioritization of medical, dental, behavioral health, prescription, so the core services that health centers provide, but also recognizing that people need access to social services, to unemployment, grocery stores, libraries, and the like. They've developed this system that is free to all residents of Alamosa County, and they even have wheelchair accessible services as well. So since they started their program, really right around the time of the pandemic, they've provided over 14,400 rides to people in their communities. And next slide, please. Really the core, as Sharon said before, the core of all this is belonging and civic muscle. And I want to highlight Asian Health Services in Oakland, California. Their need in this effort really stemmed from a situation in which Chinatown in Oakland, California had been bisected by an urban highway, which caused a greater degree of traffic and actually led to the deaths of people through motor vehicle accidents. So people were getting hit and killed in an area that originally wasn't designed for this kind of thoroughfare going through in urban area. So they pulled their community partners together and led this Revive Chinatown initiative back in the early 2000s. And it took several years, but they were able to draw in city resources to improve the pedestrian flow of traffic, to also provide resources to improve Chinatown parks, but importantly, to engage the Chinese American community in the civic planning and development within Oakland and within Chinatown specifically. So they improved language access and equity, and also brought in other resources to improve public and private projects within Chinatown. Again, having a community health center that's led by the people receiving services allows them to be strong advocates for the needs of the patients that they see. And a shining example to me is Asian Health Services. So I just wanted to bring you some of those bright spots, some of those examples of how health centers are working in the vital conditions. And as our team develops more of our effort around aligning our SDOH efforts at NAC, we intend to highlight and elevate many of the other models that exist throughout the country. Becky, thank you so much